Their interest is coming up with an approach, a therapy that may be applied to all inborn errors of metabolism of the liver, noting that there's unique differences between them. So at this meeting, we presented our work with the large animal model of human type 1 tyrosinemia and our gene correction strategy. Several years ago, our group created the first HT1 large animal model of HT1, and once we got the animal characterized and the phenotype matched very closely, exactly really the disease phenotype in humans, we set out in an ex vivo manner doing a partial hepatectomy where we remove part of the liver, take those cells from that liver, isolate those liver cells, and then take our virus that's delivering our gene of interest, and we use that to infect those cells to deliver our gene of interest, and then we take those corrected cells and we put those back into the animal. So it's what we call an autologous transplant, so an ex vivo gene therapy with autologous cells to treat the HT1 disorder. HT1 was something we were really interested in starting with because it's a unique disease amongst the inborn errors of metabolism of the liver. A corrected cell has a strong selective survival advantage over an uncorrected cell, so that even if you only get, for instance, 1% of the cells corrected in the liver, that over a period of a few weeks to typically a few months, that the liver gets to be completely repopulated with a corrected cell at the expense of the uncorrected cell. And for us, it was a great proof of concept to be able to do this, to show that we could stably engraft our cells in this manner, that we could stably express over the period of years, that our correction of the disease phenotype was also stable, and that we were able to ameliorate the disease condition with regards to cirrhosis, fibrosis, and the cancer condition that typically follows with those people who are poorly treated for HT1. So our data is really supports our ability to do that, and we intend to take this preclinical proof of concept to the next level, which is to start a trial to enroll patients who otherwise would be benefited by an ex vivo approach. HT1 is great in that regard, and then our other focus is to focus on those inborn errors of metabolism disorders of the liver that don't have a strong selective advantage for a corrected cell. PKU is another disease that we're strongly interested in. We're creating the first large animal model ever for the PKU disorder, and we hope to augment our approach that we have now to treat the PKU condition in much the same way that we're treating HT1.